While medical advances have allowed many people with obesity to live longer than in previous generations, the issue of how those years are lived, what kind of health, independence, and vitality a person experiences, raises important questions about the true cost of excess weight over time. Obesity does not just influence the odds of reaching an older age, it also profoundly affects the quality of life during those later years. Even when it does not directly shorten lifespan, it often reduces health span, the number of years lived without serious disability, pain, or chronic disease. This distinction between living long and living well is especially important in aging populations where obesity can silently erode physical, emotional, and social well-being. Epidemiological studies show that moderate to severe obesity is associated with reduced longevity. Carrying excessive weight throughout life increases the risk of early death from cardiovascular disease, diabetes, cancer, and kidney disease. Even when these conditions are managed with medication, their presence increases physiological wear and tear. The body, constantly working harder under the strain of excess fat and chronic inflammation, ages faster at a cellular level. Telomeres, protective caps on chromosomes that naturally shorten with age, tend to be shorter in obese individuals, suggesting an acceleration of biological aging. While not all obese individuals die young, the statistical odds are clear. The higher the body mass index, particularly in midlife, the more likely a person is to face premature mortality. However, the story becomes more complicated when we examine older adults who have already lived into their 70s or 80s with obesity. Some observational studies have shown what is called the obesity paradox, where mildly overweight or obese older adults sometimes appear to have lower mortality rates than those with very low body weight. But this paradox may be misleading. In many cases, thinness in old age reflects muscle loss or undiagnosed illness, rather than robust health. And while some obese older adults survive longer, they are more likely to do so with significant health burdens, cardiovascular problems, arthritis, impaired mobility, diabetes complications, or cognitive decline that diminish daily function and autonomy. They live longer, perhaps, but often with far less vitality and more suffering. Obesity tends to lower the threshold at which age-related declines become disabling. For example, joint deterioration that might have remained manageable in a lean person can become crippling under the stress of extra weight. Fatigue, breathlessness, and poor circulation also limit exercise tolerance, reducing participation in social and physical activities that are essential for mental and emotional health. The burden of chronic diseases often requires multiple medications, which can interact poorly and cause side effects like dizziness, weakness, or digestive upset. These factors collectively erode quality of life and make even routine tasks, climbing stairs, getting dressed, preparing meals, more exhausting and frustrating. Emotional health is another area where obesity takes its toll during aging. Stigma, reduced mobility, and social withdrawal can contribute to depression, anxiety, or loneliness, conditions that are not only emotionally painful, but that also negatively impact physical health and recovery. Cognitive function may also be affected. Midlife obesity is a known risk factor for dementia, possibly due to vascular damage, insulin resistance, and chronic inflammation. While not every older adult with obesity will face cognitive decline, the risk is higher, and when cognitive problems occur alongside physical limitations, the overall life experience can become profoundly diminished. Despite these concerns, there is a hopeful and actionable dimension to this conversation. Research shows that even small reductions in weight, particularly visceral fat, can lead to meaningful improvements in health outcomes, mobility, and mood. A loss of just 5 to 10% of body weight in obese older adults can lower blood pressure, improve blood sugar control, ease joint pain, and reduce inflammation. These benefits are not limited to the young. They extend into later life and can help older adults recapture years of physical function and independence that might otherwise be lost. Importantly, the goal of intervention in older adults should not be aggressive weight loss or pursuit of a normal BMI at all costs. Instead, it should focus on functional wellness, reducing fat mass in a way that preserves muscle, enhances movement, and supports brain and heart health. A balanced diet rich in nutrients, regular low-impact exercise, proper sleep, and emotional support systems can all help improve quality of life without drastic or harmful measures. In sum, obesity casts a long shadow across the aging process. It can reduce lifespan in some and increase suffering in others who do live longer. Yet within this challenge lies opportunity. Through targeted, compassionate lifestyle changes, older adults with obesity can still take control of their health trajectory. By focusing on the quality, not just the quantity, of years lived, individuals and caregivers can shift the narrative from survival to thriving, ensuring that aging is not merely endured but experienced with strength, dignity, and joy.